Welcome back to another edition of the Hart2Heart Podcast. And my guest today is Dr. Renita Ahluwalia. She's a Canadian dermatologist. So, Dr. Ahluwalia, welcome to the show.
Thanks so much for having me, Mike.
So I'm really excited to chat with you today. I went over Dr. Huberman's Skin Appearance podcast pretty well there. Maybe it was about a month ago or something like that. And obviously as a family doctor, I still see a lot of skin conditions all the time in walk-in clinics. So, there's a lot of different reasons why I do want to chat with you today. But before we get started, can you just give the audience a little bit of a brief background about yourself?
Sure. I'm a dermatologist in Toronto. My husband was a plastic surgeon, and I co-founded the Canadian Dermatology and Plastic Surgery Centers 5 years ago. And so we're full service dermatology, plastic surgery, and we have a complete med spa. So we see a wide variety of different dermatological and plastic surgery issues.
Awesome. So I imagine one of the things that, a lot of your clients, a lot of your patients that are coming to you really want to know is, how they can look better, how their skin appearance can improve, So one of the things that I wanted to ask you about today was, different modalities, different treatments that people are using to, improve the appearance of your skin. And then also too, we may talk about, a few specific dermatological conditions as well. But one kind of really, really hot topic right now, I imagine this is something that you get asked quite a bit, is we know red light therapy is something that a lot of people are using to improve the appearance of their skin. So is this something that you have been asked about by some of your patients before? And when they do ask you about it, what is your advice on using red light therapy?
You're totally right about red light therapy increasing in popularity. Most of the red light therapy are actually in the form of at-home devices that people use. Usually what we have in office are stronger laser type devices that are more powerful and have more evidence behind them. But red light is very interesting. So LED light in general works by kind of stimulating the mitochondria, our powerhouse cells. And what that can result in the skin is increased blood flow, increased collagen production, increased fibroblasts, which can lead to increased collagen production. So the science behind it is really neat. The problem though is that there's a lot of different devices out there, and not all of them have a lot of science behind them. There are some that do have smaller studies that do show that they're helpful. So if I have patients who want to use them, I do encourage it. And I do have patients who have seen good results in both their skin and their hair. We also have a hair transplant center here. And so, we always talk about it, even for the skin, we always talk about, maintenance and active procedures. So if you're doing at home LED therapy or red light therapy for your hair or for your skin, you certainly can see benefits, but you're more likely to see benefits in combination with, good skincare or hair care and then appropriate in-office procedures too.
Okay, so a couple of questions then I have for you there. So one thing that's really interesting about the mitochondria, because I'm not sure if you're familiar with Dr. Casey Means, but she was on my podcast pretty recently. She wrote a book called Good Energy. Her husband is Dr. Callie Means. He's been on Tucker Carlson, been talking about Ozempic and different drugs like that before. But one thing she was talking about with mitochondria was mostly for energy, but you're saying that, essentially better mitochondrial health in general would be better for skin health. Is that correct?
Yeah, I think there's more and more evidence to suggest that, like, if our cellular function is working better, then all our organs are going to certainly benefit. If those powerhouse cells are working well to create and improve energy, and you're improving blood flow and you're improving stimulation of your fibroblasts, of factors involved in collagen production, then you're going to see healthier skin, nails, hair too.
Amazing. Okay, I didn't know that. I knew mitochondria health was tied to better energy, but I didn't know that mitochondrial health was actually tied to better skin health. So that's very, very interesting. I wonder if some of the supplements that are helpful for people with, benefiting their mitochondria. Then, like some people take like Alcar or urolithin A is a big new one people are taking to boost mitochondrial health. And, potentially, I don't think there's too many studies on it yet, but I wonder if they'll be, helpful then in the future for just improving skin appearance. And then the other thing too that you mentioned there that I thought was really interesting, you said like there's different kinds of at-home lights and in-treatment lights for red light therapy. So I don't know if you can get into like the specific unit or length of time or wavelength, but what is it about the treatments that say you would have at your clinic that would be different and that would make them more effective than say some of the treatments that people had at home?
So, these LED lights are generally not used in office because they're like low level stimulation. So in office, we want like people come in, they want to do 1 or 2 or a series of 3 procedures and really see good results. So for those kind of things, we use different types of lasers. So, one of our very popular devices includes radio frequency micro needling, right? So you're having radio frequency energy plus needles that go into the skin to really stimulate more collagen production than what typical LED or red light therapy can do, which is, the studies on red light therapy alone, the science is good, the basic science is good, but the studies on the actual devices are not as good, right? And so some companies like that make the helmets or make these masks have, decent clinicals, so we do support patients who want to use them, but it's not something that I generally advocate for. Whereas with the lasers and stuff we have in clinic, the results are more predictable. So it depends what someone wants to do, right? Like, so in theory, red light can help like with collagen stimulation. So it can help with fine lines and wrinkles. It can help with acne. It can help with pigmentation. But I have a whole army of devices in clinic that are designed and have proper clinical studies to show that they work in those specific areas. So if someone has a lot of pigmentation in their skin, we can use like the pico laser, which is very fast switching laser that targets pigment, and we can destroy those pigment clusters. And I know I'm going to get a more predictable result. If someone has a lot of lines and they want to resurface their skin, I can use an ablative laser like a CO2 and give them really nice skin resurfacing in a very predictable way. So it really just depends what the patient is looking for. And a lot of patients are really savvy these days. They're coming in wanting more prevention. And so often they choose a good skincare routine and they want to do like at-home type of things. So it's certainly something that's not dangerous and could benefit their skin if they want to do it.
So it sounds like you offer, a variety of different treatments, like beyond just the red light therapy. Like when you're talking about these other machines, like the Pico machine, like these are not red light therapy devices. These are separate. Is that correct?
Yeah, they all have different wavelengths, and they all target different areas of the skin. So one of our very popular devices combines like the radio frequency microneedling plus CO2, so you can get full rejuvenation of the different layers of the skin. The Pico is very good at treating pigment. You can remove tattoos with it. We have a vascular laser that specifically targets like vessels in the skin. It's really good for like patients with rosacea, patients with flushing, great on like leg veins. We have machines that use radio frequency energy to flex different muscles. So one does the equivalent of 54,000 crunches in 15 minutes. We use that monopolar radio frequency energy also to heat up fat cells and destroy local areas of fat. We can use, laser genesis, which is a lower level laser treatment to stimulate collagen in the skin with no downtime. We have IPL, which is intense pulse light, which targets reds and browns in the skin. So there's really targeted ways to address an individual's skin plan and completely customize that for them.
Okay, excellent. Yeah, I had no idea that there was so many things available. Like I knew a little bit about the IPL, but there's a lot of things here that you're definitely teaching me today. Just coming back to the red light just for 1 second. in terms of like unit of measurement or like how far away someone should be, like if they are looking to, purchase a red light device at home, like is there a certain way you guide people into which one to get? Like feel free to promote one if you're associated with one. That's totally fine.
I'm not really associated with any, but I have like the different companies have sent me different devices, and I've looked at like some of the studies behind them. And, at home we have the Omnilux helmet. We were sent it, and Quinn uses it my husband uses it for his hair once in a while. And, he actually kind of likes it. He's not so consistent with it. And they do have fairly decent studies, and they also have a mask. The other one is Current Body. So we have that one too. They're both like pretty equivalent in the amount of evidence behind them and in terms of what energy is used in the devices. But there's a lot of variability. So I would look, like I advise people to look and see what is the scientific evidence. Do they have any studies before they purchase it, or try to consult with someone who might know a little bit more about it?
Yeah, I think it's really good advice, because there are a lot of, different devices out there, and you do want to be careful and kind of evaluate them before you make the decision and go ahead and do that. So I think we've kind of, beat up red light therapy enough there for today. So I kind of want to move on here now. But one thing that, we should be talking about, obviously, any skin conversation, sun and sunscreen. So, I read something recently indicating that 80% of damage to the skin is usually from the sun. I don't know if you agree with that or not, but, we know that obviously that sun can increase skin aging. And so, what kind of sunscreen do you recommend for people? And maybe I should take a step back and say, what is your overall sort of approach for people when going out in the sun? Because obviously we know that people do need a little bit of sun, for regulating your circadian rhythm, those types of things. I've always been, not always, over the last couple of years anyway, I've been definitely advocating for people, particularly if they're suffering from depression, to get a little bit of sunlight in the morning. Dr. Andrew Huberman, again, has really popularized that. But again, maybe I should take a little bit of a step back and like, what is your overall approach to, protecting yourself from the sun and from skin damage?
Yeah, I'm glad that we're talking about this, because we have people who are coming in and they want to spend a lot of money on, resurfacing their skin and improving their skin. But then when you talk to them about their skincare routine, it doesn't include sunscreen. And so I tell them, if you want to maintain this result and decrease your risk of getting skin cancer, then sunscreen is a must. It's a non-negotiable. Like, so for any patient of mine who's coming to do treatments, I highly encourage it. Sun protection is important, like especially for children too, because any sunburns and damage you get at a young age will really increase your risk of getting skin cancer in the future. So sun protective shirts, hats, avoidance of like peak hours of the sun are all really important. And then a good SPF. Like, there's all these really concerning trends, and myself and a bunch of my colleagues were interviewed by like media outlets recently about them. About people making their own sunscreens at home or avoiding sunscreen because commercial sunscreens are dangerous. But we really want to get the messaging across that there's really no evidence to suggest that. Some people who don't want to use chemical-based sunscreens feel more comfortable using mineral-based sunscreens. And a lot of the, cosmetically appealing mineral sunscreens are also tinted these days. And the tints actually have even extra benefits. There's more and more evidence because the tints are made of iron oxide pigments, and that can filter visible light, which can reduce the appearance of brown spots and pigmentation on the skin, which is really neat. But as far as sunscreens goes, I just tell patients there's so many options out there now. There are sprays, there are sticks, there are creams, there are lotions. So it's like something that is at least an SPF 30, so that's a reflection of the UVB, that also has UVA coverage, so something that's broad spectrum that they like to wear and that they will wear every day. So there's so many options. We have a lot in store. in our clinic. And then there's lots of options at drugstores that we advise patients about. It's just finding one you like and wearing it every day consistently.
Yeah, I think that's, very important because, again, like I said, about 80% of the the damage that people incur from the skin generally is from the sun. And if you look at some of these pictures, I'm sure you've seen them, like truck drivers who have like an arm out the window or something like that. I mean, you can clearly see that, like,
yeah, with the milkman and half his face is out the window and they look like two different people, like all the changes and it's called solar elastosis. So, the skin gets saggy, gets more wrinkled, you get like almost cysts in the skin. It's quite dramatic.
Solar elastosis. Wow, you're teaching me a lot today. I really appreciate this. So this is going great. And one thing too about the sunscreen there as well is, like, this is something obviously you're going to want to put on more when the UV index is higher. So, maybe in the, morning time when the UV index is low and you're mostly getting, red light and not as much of that UV light from the sun, you may not have to apply as much. Obviously, you still have to be really careful and, again, check the UV index, because sometimes when it's even like cloudy, the UV index can be high. So you need to sort of do your diligence there. But that's what I always, mention to people too, is like, they think like, hot, if it's hot out, you need to put on more sunscreen. And, obviously sometimes the UV index and the temperature do go up hand in hand, but not necessarily all the time. So that's always something that I always mention to people is, maybe check the UV index more than the temperature. I find people sort of do the opposite. I don't know if you found that with your clients or your patients as well.
Yeah, but I think the message that I always tell people is every day, 365 days a year, whether it's cold or hot, whatever the UV index is, it's still important to make it part of your daily routine, because you are still getting that cumulative exposure. And so it's, it's important for skin health and important for the reducing risks of developing skin cancer. So I say make it part of your morning skincare routine every day, 365 days a year. And certainly what you're saying is true, like on days when it's higher UV index, in those peak hours of the sun between 10 to 3, make sure you're appropriately protected and reapply if needed.
Excellent. And then one thing too, I only found this out recently. I don't know if this is something that has enough evidence where we can, certainly put it out there, but it's interesting information. I saw a study in 2018, I think it was, that indicated that 4 milligrams of Accutane in a double-blind placebo-controlled trial did help reduce the sun damage from UV rays. So I just wasn't sure if there's a particular supplement or something else out there that you may recommend to your patients if you are going to be going on a vacation and you're going to be exposed to the sun. Is there something, I guess, oral that people can take that may be protective?
The one that has the most evidence behind it, it's called HelioCare. It's polypodium leukomactose. I have to check the pronunciation of that. But that supplement can boost your internal sun protection capacities by small amount.
Very, very interesting. But even so, even if it is a small amount, like we are talking about something that you accumulate every day. And from my understanding, but please correct me if I'm wrong, like when you are getting, UV rays and, exposing yourself potentially to, carcinogenic or cancer causing effects, it's more or less like the overall cumulative UV rays that you get. So I'm not saying it's okay to burn or anything like that, but from my understanding, burning is essentially you're just burning the epidermis of your skin. Now, obviously, if you burn the epidermis of your skin, you must have exposed yourself to a bunch of UV rays, and doing that over time is, obviously going to lead to cancer. But from my understanding, it's the cumulative effects of the UV rays that would eventually lead to cancer-causing effects. Is that correct?
It's both. Like certainly people, and you kind of said that. Like it's both. So if you have like more than 2 high intensity sunburns, particularly at a young age, that will significantly increase your risk of developing skin cancer in the future. And that's quite well established.
Really?
So
I didn't know
sunburns
that.
are very bad. Yeah, sunburns are very bad, in particular blistering sunburns, and in particular at a young age. So that's really important. But like you said, cumulative damage also is a big risk factor.
Do we know the reason why it's so bad for kids to sunburn, say, versus adults? Like, what is the reasoning behind them potentially, get it being worse
I think
off
it's
when
bad
there's
for
sun
adults
damage versus
too.
an adult?
I just think, yeah, I think it's bad for adults too. I just think there's that evidence that, like, if kids are getting those blistering burns and they follow those cohorts over time, those are the people who are more likely to develop skin cancer. I think that's just how that's been looked at and studied. And I think a lot of that DNA damage does occur early, so it's really important to protect kids. I mean, their repair mechanisms are good too. I think it's just the data that we have, and certainly I think in adults too who have that type of damage, that's also increasing their risk, certainly.
That's very interesting, and I think a lot of people will be surprised to hear that. So I really appreciate you saying that here today. So I think we've kind of talked a little bit about the sunscreen and how to protect ourselves from the sun, and how much damage the sun can be to if you are repeatedly exposing yourself. Again, just go look at some of the pictures that Dr. Ahluwalia and I are talking about today. You can Google them in 2 seconds and you'll see. So one question I have, I don't know if there's even a good answer to this or not. Like, maybe it's just, obviously you want a good diet to be a healthy person in general, but, is there any specific things that you say to your patients that would be different than, say, someone who, just wants to have a healthy diet for, general maintenance or reducing cardiovascular risk or whatever it is? Like, is there something specific for patients who want to improve their skin that you tell them to eat or not to eat?
Not generally. People who have skin conditions in particular always ask me this, like people who have acne or psoriasis or atopic dermatitis. And my answer is, usually, like, there's not a lot of scientific evidence. Like for acne, there's some studies implicating dairy. But when they look at it as a population, not a lot of specific triggers come up. But what I tell people is, anything that they feel causes inflammation in their gut, things that make their digestive processes not feel well, to avoid those types of foods if they have a skin condition. So for a lot of people, that is dairy. For a lot of people, that's gluten. For a lot of people, that's sugary foods, high glycemic index foods. So I do explore it with people, particularly in people who have skin conditions. But for overall skin health, I think it's what you said: healthy, well-balanced diet makes a difference. And what you touched on before, there's like not enough scientific evidence to really comment on, but like, what kind of supplementation should we take to improve our skin? It's an interesting area, and I think like the science is emerging. Like even with the oral collagen, a couple of years ago, I didn't think there was any evidence for it, and now there's more and more evidence that maybe certain types of oral collagen can actually be quite beneficial for the skin in the long term. So I'd like to see more data on that, and I think it'll come as time goes on. Yeah,
I got to say, I've never recommended or not recommended specific foods to a patient for skin health in particular. And in terms of like data and publications online, like I've seen some things on low levels of omega-3 may be linked to higher rates of acne or worsening acne, but I've never seen a study that shows that introducing fish oil or introducing omega-3 like dramatically improves skin. I'm not saying that it doesn't, and if you want to optimize everything, I would say make sure that you do have a proper omega-3 to omega-6 ratio, but you want to do that anyway. So it sounds like really there's not too much specific to skin overall. But one thing too, maybe you can comment on this. I think that I heard Dr. Huberman say that your immune system is also a reflection of your skin health and vice versa. So, I mean, if you want to boost your immune system, or maybe not boost your immune system, have an optimally functioning immune system, obviously that entails eating well. And so I imagine that, your immune system reflecting your skin kind of makes sense in that regard. Is that something that you've kind of noticed with your patients, or it's something that you've picked up from literature that, skin health and immune health are, a bidirectional relationship?
Yeah, I think that definitely resonates with me. It makes sense, that concept. And certainly we see, like, in skin conditions like atopic dermatitis, psoriasis, where there are, especially in atopic dermatitis, where there is a barrier dysfunction of the skin, that sometimes those patients, especially the more severe ones, also do have immune-related issues. And improving the skin barrier and improving their skin reduces that overall inflammation in their bodies too, for both psoriasis and atopic dermatitis patients.
Interesting. Yeah. And just coming back to the supplements there for a second. So you let me know if I, said anything incorrect here, and please let me know if I did. So I put out something recently about, how to improve skin health. And these were the 5 things basically that I had recommended. So one we already talked about was collagen. So I said 15 to 30 grams a day. And there was some, pretty decent evidence on that, I think, coming out. One mention I'll say there is, from my understanding,
But there's different types. Like there's like Viracell collagen, which I heard from a lot of people, the bioactivity is better. And so the way it's metabolized is better. And like you'll get more protein stimulation and development in the skin to stimulate more collagen. But I don't know, because the science, I haven't really been able to find that. So I don't know which type of collagen supplement to advise my patients to get. So that's where it becomes tricky for me. So that's something that I would like to know for myself and for my patient.
Yeah, I mean, definitely need more research on it for sure. Like, from my understanding anyway, it's 1 in 3 that are, supposed to be more effective for the skin. Right. And then collagen type number 2 is supposed to be more effective for joint health.
Right. Those are just the types of collagen. But like the sources of what we're supposed to take and how that's going to make, because it's not that you take the collagen, it's not that you take the oral collagen and and then that's how it works. It like gets broken down to proteins, and then that's supposed to make your body make more collagen, right? So what I want to know is then which type makes your, like, what source of collagen, not like the type of collagen, which sources of collagen are the most effective? Is it bovine? Is it marine? Is it Viracell? Mm-hmm. And like what the evidence for that is.
That's a very, very interesting question, and something that, and I even saw something on, like, I think fish collagen the other day for skin health. So there's marine collagen, there's all these types of different collagen. So we do need to figure out like what the best, I guess, source is there overall. From my understanding, there's still some evidence indicating that, the collagen that people are taking now is, has some effectiveness. But still, it's, there's still a lot more that we need to learn, like you said, on the different kind of types. And again, it doesn't make sense that, like, you take something orally and then like it like traffics these like amino acids into like specific areas and then makes your skin like appear better. Like, it just, it's kind of blurry science, and we do need to, understand, even just the mechanism of action of how it's working. But, some people are saying that, when they're taking it, better skin appearance and all this kind of stuff. So, interesting to kind of look into the future. I'll just get back to the list really quickly, if that's okay.
Sure.
Vitamin C, not much is recommended though, just like 500 to 1,000 milligrams. Most people can get that in their diet, and it's often too within collagen supplements, so you don't need to usually get it. And then topical vitamin C seems to have like some.
Yeah, topical vitamin C. I was just going to say, there's a lot of evidence for topical vitamin C in the right formulation. So you need pure L-ascorbic acid in a concentration between 10 and 15%. It should be formulated at an acidic pH. And then if there's synergistic antioxidants for your skin type, you can get up to 8 times the environmental protection with some of these appropriate vitamin Cs.
Wow. Okay, that's
topically.
That sounds amazing.
So that's what I recommend to most of my patients who want to improve their skin health is like a potent vitamin C, a mineral tinted sunscreen, and using like a topical retinol at night if they're able to.
Okay, amazing. Well, thanks for sharing that, because again, I didn't know there was so much evidence on it, and when a dermatologist says it, there's just a lot more weight behind it. So I appreciate you saying that.
Yeah, but I think there's lots of different formulas, so you have to make sure those parameters are met for sure.
So 10 to 15%, that's what you're saying is most important. Is that right?
Yeah, and L-ascorbic acid, the pure form of vitamin C.
Okay. Perfect. Well, I think everyone heard that one loud and clear. So, get your vitamin C topically. The other thing I mentioned too, a couple other things. So, niacinamide, so 500 milligrams twice a day seems to help with, various different skin disorders. The only thing about that now is I have seen some, stuff about, we all know going through medical school that niacin has these dramatic improvements in some of the lipid profile, but didn't really see too much improvement in reducing cardiovascular disease from what I can see. And so I understand that they're a little bit worried about there's a metabolite from niacin or niacinamide that may cause some type of cardiovascular issue. So I'm a little bit wary of, recommending the niacinamide, but, I have seen some studies indicating that it can be helpful for virtually almost every skin disorder, like aging, hyperpigmentation, acne, psoriasis. But again, I just sort of am a little bit wary just because I saw that metabolite study about niacinamide coming out maybe 3 or 4 months ago it was, but not sure if you have any thoughts on that.
Yeah, and I'm not sure really if there's any real strong evidence for oral niacinamide in terms of skin health, but that's interesting. Certainly topically, it's an ingredient that is very popular, for anti-inflammation and pigmentation. So it's in a lot of skincare products.
What are your thoughts on hyaluronic acid? I've seen that taking it orally can improve skin appearance overall. Is that something that you recommend, or something that you only recommend topically, or what are your thoughts on hyaluronic acid?
I think the evidence for taking it orally is minimal, and the way that it's used as a topical product in the skin is as a moisturizer. Because it's a powerful humectant. It draws water into the skin, so it makes the appearance of the skin more hydrated. Topical hyaluronic acid doesn't make your skin make more hyaluronic acid. It's a humectant that draws water into the skin. So there are other ingredients like topically that have been studied, like proxylane, for example, that when applied topically can make your body make more hyaluronic acid. And there's some studies to support that. And then certainly hyaluronic acid, when we use fillers, like cosmetic fillers, to shape and lift the face or plump certain areas of the face, that's the best way to deliver hyaluronic acid for plumping or filling or lifting effect into the skin.
Okay. Interesting. One thing I wanted to ask you about today is, we see, now men's skincare products, versus say just, skincare products in general. So is there any kind of difference in treating men versus women for their skin, or do you recommend any differences for their skincare routine, or is this kind of all like the men's skincare is kind of like just pure BS and there's just only one way to take care of your skin and it doesn't matter whether you're female or male?
Well, I think there are lots of different ways of looking after your skin. And I think it depends on what your skin concerns are, what your skin type is, what your goals are, what your budget is, and like how many steps you want to do in a routine. So, as in general, and it's not always the case, often men want a more simplified routine. Just because in general, men want to do that type of thing. It's like that in my house. My husband is like that. We have like everything. So he's like, what should I put on my face? So when it can be simplified, that's often easiest. And there are certain products that are designed for men. It is more marketing just to kind of make their lives easier in, making a simplified skincare routine. But it's not so much based on whether you're a man or a woman. It's based on like what your skincare needs are, what your skin type is, what type of skincare routine I would recommend. But the things that I always recommend to everyone are a good vitamin C, a good sunscreen, and if you can tolerate a little bit of retinol, and cleanse and moisturize, because those are the things that have the most scientific evidence behind them.
Okay, excellent. I did have retin A last on my list, and we did already discuss hyaluronic acid, so we kind of gone through everything. So I really appreciate you going through that with me. If you feel comfortable, you don't have to, but can you kind of recommend or just go through your own skincare routine? Please take that as a compliment as well.
Thank you. So I do like what I just said typically. So in the morning when I have like a little more time, I cleanse in the shower. Then when I get out of the shower, I do my vitamin C. And then after the vitamin C, there's sometimes other serums that I use. Like right now I'm using one called Maestro. It's from Skin Better Science. It like regulates the skin. It's got anti-inflammatory mediators like turmeric. It brings down reds and browns in the skin. So I like that one right now. But sometimes I switch up what other serum I'll do. And then I always use a moisturizer. My skin's more on the dry side. So I like a moisturizer called Triple Lipid Repair. It's from SkinCeuticals, and it kind of mimics what's in our skin barrier and the ratio of like the cholesterol, the fatty acids, and ceramides. So I use that. And then after that, I use a mineral tinted SPF. So that's, what I do every morning. And then at night, I have 2 little kids and I work a lot. So I don't really have a lot of time these days, but I have a lot of different things that I like to try here and there when I can. But what I consistently do, I'm tired at night, and after I put the kids to bed, I often just like want to fall asleep. So I just use micellar water. I like the Bioderma one. It's the pink cap one. And that just very gently attracts all the dirt and the makeup off the skin. And then, I'm pregnant right now, so I don't use retinol right now, but a few times a week I would use retinol, or I would use, because I can't tolerate retinol every night, I would use, something with an alpha hydroxy acid like glycolic acid or lactic acid for a skin smoothing effect. And, I think where people sometimes run into problems, and I've run into that problem too, because I get sent a lot of products as a dermatologist. I was a judge for these beauty awards for Chatelaine and Hello Canada, and I get all these products, and it's so exciting, and you get excited to use them. But when you use all the different products and the way they work together, you could be allergic to something. It's a recipe for skin irritation. So just going slow and sticking with things that are consistent and backed by science is the best advice.
Yeah, I think so too, because I've had patients even recently, like I can think of one even this week who, tried some new skincare products and, things, let's just say, did not work out overall. So you definitely want to go like low and slow, and just like with everything,
Sure.
like just try one thing at a time and then see how that goes. And then because if, like anything, if you introduce two things at a time, then you don't know what's causing what. So I think that's
Right.
probably just really, really important point for not just skincare routine, but for introducing any kind of supplement or anything, because two things at one time is always a recipe for disaster.
10 things and then using more things to try to combat like the reaction, and things just get worse and worse. So I think that's really good advice. And especially like with active ingredients, they're really great, like retinol, but if you use too much, you'll get really irritated. And then that could be problematic. So like you said, start slow.
One question on the retinol. So is there a certain percentage that you start your patients off with? Like, is it like 0.025 once a week or, twice a week?
There's no certain percentage. So like sometimes, there's some new prescription formulas that I really like that are like stronger retinols, like Tazorac, but they're formulated actually in a gentle medium. So sometimes I just try to go stronger earlier and just say to use it once or twice a week. There's also actually some really great products out there now. One I really like is that Alpha Ret by Skin Better Science. And so it actually is a retinoic acid 0.1% that's conjugated with a lactic acid, and it's very tolerable. Patients get good results and they're able to use it almost every night from the get-go. So it certainly depends on what the patient's skin type is, how sensitive they are. But always with prescription grade retinols, I say to go slow and slowly introduce, like start half a pea-sized amount a couple times a week. And if you're doing well, some patients can do it every night and some patients can't. They stick to the once or twice a week. Okay. So that's kind of the struggle with retinol, is like you want to use it more to increase efficacy, but you don't want to get so much irritation that it's not helping your skin.
Yeah, exactly. Okay. I think really appreciate you answering that, because a lot of people, I think, have a lot of confusion about Retin A, because I have had patients, that have had horrible experiences with it. And then I've had patients who have had, excellent experiences with it. So I really do appreciate you clearing that up. Anything else on, I think we've done a pretty good job, but anything else on anti-aging that, you think that we may have left out here today, or?
I think we've covered all kind of the hot topics. I think the number one thing, and people are sometimes still even shocked to learn that, is wearing sunscreen every day. That's the number one anti-aging secret. And then depending on your skin type, building a routine that works for you. And then there's lots of different in-office procedures people can do to improve specific concerns.
Amazing. So just I know we have a few minutes left, and this is more not into the anti-aging, but just more of the clinical side. So I'll admit, when I was 16, or maybe I was even younger than that, 15, I think it was 14 or 15 years old, I was prescribed Accutane, and it changed my life. I had a lot of bad acne. I took Accutane, and I've never really had Accutane since. Now, obviously, that's a really, really heavy drug. You got to monitor liver enzymes on it. It can cause, there's even some issues with mental health potentially. Is it a drug that you think is still acceptable to prescribe to patients under certain circumstances, or is it something that you just don't prescribe at all?
Oh, no, we prescribe a lot of Accutane. And just like how you said, it really changes the lives of people. It improves their self-confidence. Yeah. It prevents the development of more scarring, which, is permanent. And we can treat that using devices and lasers. But if we can prevent it, it's even better. So in the right patient who needs it and who can do the monitoring, and we always monitor very closely for the things you said, like mood, liver enzymes. And the most important thing is to not get pregnant on the medication, because if a woman were to get pregnant on it, the baby could have severe birth defects. But we still use it a lot because 70% of people who take one course typically don't have problems with acne again. And so there is a lot of pushback, like a lot of parents don't want their kids to take it because they've heard bad things. But in the meantime, the child's self-esteem is suffering and their skin is getting, quite damaged. So we do spend a lot of time counseling about that. And there's lots of different ways to treat acne. So Accutane is not always necessary. Like sometimes we can do it. There's a lot of great topicals. There's antibiotics for women. Treating it hormonally has become very popular. There's actually even a laser now that's extremely popular in our practice. It's a 1726 nanometer wavelength that specifically targets the sebaceous glands, and it changes the way those sebaceous glands interact with the skin to promote an environment that acne doesn't like to live in. So it's really cool. We see a lot of really good results with that. And so a lot of patients who are on the fence about Accutane do choose to go that route and get really beautiful results too. So there's lots of options.
Amazing. Okay, very, very last question. I know we were really on a time crunch here now.
Yeah, no worries. It's okay.
Okay, perfect. Some people, they see obviously the, listed side effects for Accutane. They don't want to use it. So typically some people, I don't know if this is something that you do in your practice, but, some people still want to use monocycline, tetracycline, or some kind of, antibiotic. When I was growing up, it seemed like monocycline was the one. I took Monocycline. It didn't work for me when I was younger. Is there an antibiotic that you prefer over the other to start? Tetracycline, monocycline? I think those are the big two that most people use, if I'm right.
Yeah, actually, doxycycline, which is in the tetracycline family, as is minocycline, is the one that we most commonly use as dermatologists. Most dermatologists use that one, and the reason for that is the side effect profile is the best. Because with the minocycline, you can actually even get a drug-induced lupus. You can get bluish discoloration of the skin, and you don't see that with doxycycline. And for some patients, it's really good. It's not a long-term strategy. Typically, the dose we use is anti-inflammatory, not antimicrobial. So for many patients, we'll do like 100 milligrams for 3 months to reduce the inflammation in the skin while we're, getting a skincare routine to work or in conjunction with different laser therapy. So we don't use it like as monotherapy. And certainly, like even patients who get good response, if that's all they're doing and then they stop, often it just comes back. So we use it in short courses in combinations with topical therapy or laser therapy to get results quicker or to calm down inflammation before I want to do like a laser treatment or something like that. It's something we commonly do use in our practice.
Okay. Well, very, very thankful for telling me about the doxycycline point over the other ones. And I imagine too, the tetracycline has some issues with the sun as well. So, that's fantastic.
And I think the dosing isn't as good. Like the doxycycline, you can take 1 pill a day. So that's more beneficial and it's easier on the stomach. But I still do suggest to patients to avoid heartburn or acid reflux, to take it with food and water and don't lay down after taking it.
Okay. And just because you said we don't have two quite harvest stuff, I'm going to ask you one more question, all right? If that's okay.
Okay, sure.
So the best prescription topical cleanser, like a lot of people are using benzocaine, which is a combination of benzoyl peroxide and clindamycin. Like, is there one sort of go-to that you have, or is it more like a stepwise approach if someone's, asking you for a prescription topical cleanser?
Well, so benzocaine is not a cleanser. It's a cream that contains those ingredients.
Sorry, yeah.
If you want a prescription cleanser, actually the only prescription cleanser that there is like Benzac Gel Wash 10, which is a benzoyl peroxide wash. Some patients like that. There are actually no other prescription cleansers, but there's lots of different topicals out there. And really, what it comes down to is the type of acne the patient has. And honestly, where we are, what kind of drug coverage they have, because a lot of the younger patients can't afford some of the prescription topicals that aren't covered by the government plan. And often those are like, in my opinion, the superior topicals that have less irritation. There's like so many cool topicals out there right now. Like there's Winlevi, which is a topical anti-androgen, which is really neat, super gentle on the skin. I also really like another one. It's called Accutane gel, which is also super gentle. It's really anti-neutrophilic, so it's really good for pustules and inflammation. It's Dapsone gel is the ingredient, but those aren't covered by the government plan. So what you talked about, like the Clindoxil, certain really good retinols are covered by the government plan. So often we, make do with what we can based on a patient's drug coverage and their budget. But there's lots of different options, which is nice to incorporate with, cosmeceuticals to build a nice skincare routine for somebody. And there's like a new product that's coming out, which is a triple. So you've got the retinol, the antibiotic, and the benzoyl peroxide together, which will be really neat to see. Yeah.
Wow, that sounds
There's lots
awesome.
of innovation.
So you've covered, I think, most of the stuff that I wanted to chat about today, and I know that we are running out of time, but please tell people, more about your clinic, where they can learn more about you, where they can learn more about all the information that you're sharing online.
Yeah, absolutely. So you can follow us on Instagram. My personal Instagram is dr.renita.derm. And our clinic, our logo is in the background here. It's called Canadian Dermatology. So you can visit us at Canadian Dermatology on Instagram. And we're located in Toronto at Don Mills and York Mills. And we're full service dermatology, plastic surgery, hair transplantation, and medical spa. We also have a great research facility with a lot of research trials in different therapeutic areas. So we really do a wide variety of things to help people with their skin. And we have a great team who's super passionate about doing it. So thanks for
amazing.
Thanks
well,
for the
guys,
plug.
You heard it. If you want to get your skin, up to top 10 out of 10 level, go see Dr. Renita Ahluwalia in Toronto. She's definitely the best out there. And if you want to learn more about her, go online, learn more about her, learn more about the knowledge that she's sharing. And I'm sure your skin and appearance will definitely improve with that. So thank you again so much for coming on. I really do appreciate it. Thank you again, everybody, for watching. And as always, I'll be back again soon.